The following is a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
It is the PinPoint House Show. Dr. Lou, how are you, pal? What's going on?
John, good morning. I'm well. How are you?
I'm okay. Looking forward to getting some activity happening today.
That's good. I was out for a run this morning, so that's the right thing to do as the weather gets nicer. You and I earlier in the week were speaking about the importance of getting outside for activity. I mean, I'm a proponent of doing activity no matter what, and obviously during the winter months, if that means you've got to be doing it indoors, you've got to do that. And obviously with the COVID-19 pandemic, that was compounded even further. But now that the weather is actually getting warmer and nice enough to get out, and when I say activity, that could be a walk, it could be doing some low-level gardening. This doesn't mean you have to be breaking out into a football match or anything like that, but just getting outside. The benefits of activity are tremendous, and the benefits of activity outdoors are even better because of so many of the added benefits of it, like sunlight, which is important for vitamin D, just the natural fresh air, the mental health aspect of it, to be able to get out to, just change of scenery, fresh air, that's so important. And so I think it's really important that people do that. We know that once people start getting active again, and we know it based on the research, and I know it based even on what I see clinically at our clinics, at the PinPoint Health clinics. As these transition points happen throughout the year, people are always sort of changing their activities. And as they change their activity, they might be going back to something that they haven't done for a period of time. A good example would be something like maybe running outdoors. Maybe it's not something you've done for the last 6 months. And so now you want to get back out, you want to go for a run. It's really important. And I again, when you and I were speaking, John, I sort of said to you, it takes a pretty long time to build fitness. It doesn't take such a long time to lose fitness. And so, although 6 months may not seem like a long time for your body and its ability to decondition, if you haven't done much during those 6 months, it's actually pretty tremendous. You almost would have lost everything that you would have gained in that period of time. So it's really important that if you're going to get back out there, which I encourage everybody to do, so I'm not saying not to be active, but do this in a modified and staggered approach, right? You got to make sure that you're reintroducing this and that you're hardening your body towards it, right? So, if you prior to the winter were out running and you were doing, 5 kilometers in 30 minutes, then maybe you might want to start with 10 or 15 minutes for the first couple of days of a light jog, and just get out there. And even more important than just, doing that, the other big thing in terms of injury prevention is warming up, making sure that as you're getting into whatever activity, you're getting your body warm, you're doing dynamic things to warm up your body. And that could be as simple as walking, rolling your arms around. Dynamic stretching versus static stretching is much, much more important for injury prevention as you're getting into activity. We're used to sort of, especially our generation, John, we're used to thinking back to gym classes where the teacher would have you just stand in one place and do a bunch of static stretches prior to get going. That actually does very little for injury prevention. You've got to make it dynamic. That's what the research shows. It's all about getting the enzymes in our muscles. They work optimally at certain body temperatures, and we've got to get our body temperature up in order to have those enzymes activated so that they can do what they have to, the muscles do what they need to, and the other soft tissues, and that can help prevent injury. So that's really, really important for everybody to consider as they get back out into doing these things. We also know that injury is the biggest thing that stops people from achieving sort of their activity goals, right? Like, people are pretty good at saying, okay, I think I want to start again, and then they go do something, and with no surprise, especially if you're anywhere over the age of 30, that if you're doing something that you haven't done in a long time, you're probably going to have some aches or pains somewhere. Now, some of that may also just be delayed onset muscle soreness that happens as a result of getting stronger. Like, the workout soreness. If this is something that happens the next day, it seems to be in the muscle bellies, and it goes away within 24 to 48 hours. That's probably what it is, and that's actually a good thing, right? That means your body broke down, you're building it back up, and it's going to get stronger. And it probably, as you keep up the same level of activity, you probably won't feel that same level of delayed onset muscle soreness. But if you progress it and make it harder, you might. So that's not a bad type of pain, right? That's sort of showing you that your body is growing and becoming stronger as you're doing these things. Where I really caution people is, things that don't go away in that period of time, or that are accompanied with other things. Like if you start to notice swelling, if it seems to be more right in the joints, like if you're out going for a walk and instead of, your muscles, your quads and your hamstrings being sore, you're feeling it in your knee, as an example. That may not be delayed onset muscle soreness. And especially if you can sort of pinpoint one area on that knee, compounded even worse if it's got swelling, you might actually be dealing with something that is more than just delayed onset muscle soreness. So you've got to be careful with that, right? And if it doesn't go away within 24 to 48 hours, I would definitely get that looked at, and you could try some home remedy type of stuff in those instances, ice, heat, some rest from the particular activity, and see if that improves. And if it does, you may just be dealing with delayed onset muscle soreness. But again, the big thing here is this is why professionals exist. And we know that as people, when people don't achieve their activity goals, most of the time it's due to an injury that they just can't get through, or they try to fight through on their own. It's hurting and they keep pushing through that run every day, and they think that they'll be able to do that forever. And then, fast forward 2 weeks and all of a sudden they're in severe low back pain where they can't move. So these are not things you should push through. If you've got something going on and it's not getting better pretty quickly, I really do encourage you to get that looked at as soon as you can, because in the acute phase is where therapeutic intervention is going to be extremely helpful and likely do almost eliminate the issue so that you can get back to the activity that you want to be doing.
And info at pinpointhealth.ca. Reminder, of course, the PinPoint Health clinics, Dr. Lou's clinics are open. They're serving, they're helping people, so don't hesitate to get a hold of Dr. Lou and his amazing staff in that regard as well. Yeah, talk about that delayed onset soreness. First of all, guys who work out like you and I and anybody else listening, we love that. We get ticked off if it doesn't happen. But, to your point off the top about, you haven't done anything really strenuous for quite a bit of time or exercise, and getting back to what your body lost, never mind 6 months, man. I find, if you're at a reasonably good level already, you take 3 days off and your cardiovascular already starts to suffer. It's so depressing. That bag of fried pork rinds takes 6 months to get rid of, but when you're in shape and you're breathing and you're riding your bike or running, you take 3 or 4 days off for work purposes or whatever. It's amazing how fast your body goes, yeah, you know what? I'm good. I'm gonna dial it back a little bit. It's funny, but it's a pain in the ass.
Yeah, and I believe the stat on that is actually that when it comes to cardiovascular fitness that you achieve, like with whatever activity you're using, the example of cycling, if you don't do that activity for 2 weeks, is it 2 or 3 weeks, you lose about half of whatever achievement you have there. So that's so that means within like a month, right, or 6 weeks, if you don't do that activity, and that's the biggest thing, John, with injuries, right? Like that's what we really worry about, even with athletes, when we're trying to that's why the early intervention, when people feel something early on, you don't want to get to the point where, especially if you've achieved a goal or you're achieving a goal that you've set out to do with your fitness, you don't want to get to a point where something's going to knock you off for a month or 6 weeks, because that almost sets you right back to wherever you started. And to achieve that same level of fitness, as you know, John, and as you're saying, might take 6 months, 8 months, a year in some cases. It depends what we're talking about, what level of fitness we're talking about. So that's pretty staggering, right, in terms of how quickly you can lose that. And it's really important that I think, again, people make sure that when they're feeling these early hints of a problem, as you're getting back into fitness, that you do your best to get it looked at that point, because that's really when the best solutions are available. And I've talked about that for 5 years on this show. In the acute setting is always when you're going to have the best impact with musculoskeletal injuries. The minute you start letting these things go on and on and on, it gets so much more complicated. Doesn't mean it's impossible, But I mean, I think we could all agree that we'd prefer simple solutions over complex solutions.
Email is info@pinpointhealth.ca. And we'll continue. Pinpoint Health Show right here, Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
Yeah, so we're talking about the benefits of getting out and doing your activities outdoor, and with the change in season and the change in activity that people will probably do at this time, sort of some of the injuries that will happen, and just to sort of get into some of the more common injuries that happen during this time as people get out. I think things like knee pain is obviously, it's a constant one with any type of activity, but obviously as you're getting back out and a lot of whatever you're probably doing includes a walking or running component, that's going to be important, especially as you get back to walking outdoors. People during the winters may have been using their treadmills or whatever other fitness devices they have in their homes. That's never the same as walking outside, right? Once you get outdoors or you're hiking or running outdoors, there's different undulations and the way things shift and whatever. And so that can create a lot of mechanical issues in the knees, the feet, the hips, all the way into the low back. Another big thing that's always prevalent, if we talk about when it snows, we're going to talk about low back pain. But as we talk about the spring and gardening, it's equally the same, because people will spend a lot of time sort of in a bent posture, whether it's cleaning up their yards or whatever it may be. And that creates this thing called creep in the ligaments and the muscles in the spine, which creates an instability. And that's where injury is likely to happen. So that's an important thing too. So you've got low back pain, you've got hip pain, knee pain, foot pain. These are all very, very common things that we'll see during these times of the year. They're really common all the time because everything sort of includes those things. But again, if you're dealing with these things, it's really important that you get looked at, especially say something like foot pain. Foot pain is sort of a monster in the sense that anyone that's had something, say a plantar fasciitis, which is one of the more common things that happens in the foot, they could tell you it's so difficult to treat. And so people that have had it and practitioners that deal with it, the patient will tell you how horrible it is and how impossible it is to get better and to, get it under control. And the practitioner will tell you the same. And the reason for that is because you can never really completely rest your foot, right? So if you had a hand injury as an example, and you saw me and I said, John, I'd like you to sort of, minimize your activities with that hand. Sure, okay, no problem. It's a lot easier to do that than it might be in most cases, obviously. It'd be a lot easier to do that versus say something like saying, hey, don't walk as much if you've got to walk. Yeah. So that's a really difficult thing when it comes to lower extremity injuries. And the reality, as you get into most of these things, you always want to make sure that there's no structural damage. Like as a practitioner, my job, if someone comes in with these things, is you want to make sure that there's nothing there that's structural, right? You haven't torn anything or broken something, because that's going to require a different level of intervention. But once that's cleared out of the way, the vast majority of the time, what you're dealing with is a functional issue. And that functional issue may be a result of, some simple things. Maybe the footwear that you're using to do that particular activity, maybe the way you're doing that particular activity, maybe there's a modification that can be included that can make it simpler for you. So these are all very simple things. A lot of the times it might also be inherent weakness that you functionally have. And what that might call for is some rehabilitation of certain muscles or certain structures in the body to get that area up to par with what it should be so that you can endure the activity. So it doesn't mean that when you see somebody for these things that they're going to tell you to stop. That's in fact often the opposite. Any good practitioner, really what they want to do is help you achieve your goal. If your goal is to be running, we want to help you achieve that goal. And that's the benefit of seeing a professional, because ultimately what happens most often when people sort of try to deal with these things on their own is that as the pain gets worse, that will eventually have them stop that activity completely. And then you're sort of left, where you don't want to be. And so again, it's really valuable to have a professional look at these things and understand the mechanics of the body. And these are services that are offered at PinPoint Health Clinics, but not only at PinPoint Health Clinics. There's a lot of professionals out there that do this type of stuff. And again, I encourage people to utilize the system correctly, and get that type of advice if they need it.
I think, to your point, a good practitioner you're dealing with will tell you, you got to fix this. It's because you just got back to it. Maybe you're a little out of shape, but don't stop what you're doing. I mean, I look at you mentioned running. I look at cycling, which is kind of what I'm into. And yeah, for the first couple of weeks when you get back out there on the trails and cycle, you might have a little bit of a knee gripe and you might get some saddle sores on your ass from the bike seat, but you just temper it and work through it because you're eventually going to build up that callus again. And I think that goes for any sport, and any practitioner I've talked to said, yeah, okay, here's how you deal with it, but don't let it stop you. There's a bit of a work through it attitude as well, right?
Yeah, absolutely. And I guess the benefit of a professional or a practitioner is you can identify when it's a work through it versus, okay, you've got to stop, right? Like if there's structural damage, if you're going for a run and you're getting pretty severe knee pain, and it turns out you've got a torn meniscus that happened on your first time out there and you're not realizing that, well, you've got to remedy that, and that might make you stop running. But the meniscus issue is a good example where maybe we might have you stop running, but we might encourage you to cycle, right? Because we know that might put less pressure on the meniscus. So that is the benefit of working with a professional is they'll understand the modifications that need to be made to sort of keep you active. And also, listen, everyone wants to avoid the more invasive procedures like surgery and things like that. And even surgeons want you to avoid those things if you don't need them. But the reality is if you're at a point where you need it, like an example being a meniscus that gets stuck and causes locking in the knee. I mean, whether you think surgery is a good idea or not a good idea, in that case, it's almost the only solution. And it's sort of an emergency thing, and you've got to get it done because the damage that can cause long term is so much greater. And again, everybody, including the surgeons themselves, I work with a few of them. I know their approach. They want to avoid people doing surgery. They want them to use the more conservative measures first and eliminate those things as options before jumping to surgery, because it's a more invasive option. And, they want to make sure that you've done everything else. And if you can symptomatically get better with other interventions, that's not a bad thing. But if you're at the point where surgery is something that someone is recommending, it might be an important thing to really consider. And I sort of deal with this quite a bit where I see people who might be surgical candidates for one thing or another, and they really come in saying, well, I don't want to do it, but I want my pain to disappear. And, there's only so much, right, that can be done at certain points. And this is where understanding the progression through the different levels of treatment intervention is important, and why that acute scenario, dealing with things, and that's the benefit, again, of what I was saying earlier about dealing with these things in the acute scenario, is in that acute scenario, that's when the conservative options are likely going to be the best and strongest thing anyways that you can do. So again, it takes an approach of understanding, and no one is inherently born with this knowledge of the human body, right? It's not just something that, we wake up and we understand. And that's why the utilization, especially of musculoskeletal healthcare professionals, is so important. People like chiropractors, physiotherapists, athletic therapists, massage therapists, these are people that are pretty well only trained in that area for that reason, and they can help guide you through these things, through your injuries, and also, prevention of those, of likely injuries that might occur as a result of the things you do.
The PinPoint Health Clinics to reach out, man, is 1-855-55 Dr. Lou, DRLOU, by the way. When does someone, I guess we'll take running or walking, for example. At what point does someone say, you know what, I've had a bit of a pain here, it's getting a little bit worse. At what point should they think about pulling the plug of going to get someone to look at him? Not rushing off to the emerge, but getting to someone like you. I mean, where do you set that barometer? Like, how do they know at what point it's just a little bit of getting back into exercise versus this might be something acute that I need to get looked at?
Sure. Yeah, and I think some of the things that I offered at the beginning of speaking about this, like where exactly is the pain? Is it more in the muscle bellies? Is it something that you felt similar to other times when you've worked out and are getting stronger? Or is this something that seems to be more in the joints? Are there other concerning things associated with it, like visible swelling or bruising or something like that? And I think the biggest indicator is if it's not gotten better within 48 hours, right? Like that's a true, and John, like if you've got delayed onset muscle soreness from a chest workout, typically within 2 days, you're going to be pretty well 90% better from that. You might have a little residual tightness at end range, but you're overall going to be much better. So I would say that that's a good thing. Like, if you've gone 48 hours and you haven't improved substantially just doing the normal things that you would do, you might be dealing with something that might be a little bit more serious. And so I think that's a good time to get something like that at least investigated. And the other problem that I see in the musculoskeletal world is people start to have these things and they go to someone who may not be as well versed in the musculoskeletal health, and it's like, well, they've ordered an MRI, and it's like, well, that could take 3 or 4 months to get, right?
Yeah.
Like, when it comes to musculoskeletal health, the physical exam that the practitioners that I mentioned can do is the most value. It's not the specialized imaging. The imaging is really there to help confirm or deny what we believe. I mean, we've had orthopedic surgeons for the knees on this show, and when we're talking about like meniscal injuries, and we ask them, like, do you prefer the MRI? And they sit there and say, no, we prefer our physical exam to understand, because the MRI is really something that's needed just to, you're 99% of the way there, and you want to 100% confirm it before you go in surgically. And I struggle with this because I see people who don't get better, and I say, well, have you seen anybody? And they say, yeah, well, I went to a walk-in clinic or whatever it may be, and they said that for my knee I need an MRI, but that's booked 3 months out, and in the last 6 weeks they've done nothing. And that's the wrong approach, right? That's not the right approach. There needs, and even worse, John, we've had people on the show that call, and post-surgical people or people that are in pain, and whoever they saw didn't even recommend that they need any type of physical intervention. And it's just crazy, because most physical problems require some type of physical intervention, and most of them can be identified with a good clinical exam and not necessarily specialized imaging. That's not always necessary, and we know that, again, based on the best research, the best practice guidelines out there, and clinical experience of anyone that deals in this realm of sort of health.
You want to email Dr. Lou anytime, info@pinpointhealth.ca, and to reach him, 1-855-55-Dr. Lou, DRLOU. Don't hesitate. We'll be back with more after a short break. Pinpoint Health Show here on Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
Welcome back, Pinpoint Health Show. You want to reach out to Dr. Lou when the show is not on, 1-855-55-Dr. Lou, DRLOU, info@pinpointhealth.ca. In that regard, going to get right over to it. Stan. Hi, Stan.
Hello.
Okay. Hey, Stan, there you are. What's going on, pal?
Listen, I have 2 teenage daughters, aged 13 and 16, that are runners. And my question is, does OHIP cover any of the costs going to see a clinic like a sports medicine clinic like PinPoint?
So it depends on the clinic that you're going to see. Some services, some sports medicine physicians might be covered by OHIP, orthopedic surgeons. There is some coverage, I believe, for physiotherapy, like post-operatively and things like that, or for seniors. The vast majority of the time, it's private insurance. I see Debbie's comment on the call screen here, John.
Okay, sure.
Saying, the injured, it seems like she's doing physio but not getting better, which is something that you hear a lot, right? So, number one, not all treatment is equal, right? Like, just saying physio isn't the same as everything else. It really depends, well, what is the intervention? There's a lot of different things that can be done in the physical medicine space. The first question becomes, are you lining up the diagnosis, the problem, with the right intervention? Second of all, what's often a big problem is that there's too much of reliance on passive intervention, which is the things that someone else does to you, versus the reliance on, and as you move through your progress, you need to rely much, much more on active care, which is the rehabilitation and the strengthening that you need to be done. And a lot of people that I meet will say, I'll say, have you been given things to do? And they'll say, yeah, I've been given some stretches. It's a lot of the times it's more strengthening than it is simple stretches. So I don't know. I know we missed Debbie, but maybe that helps her with what her question may have been.
Anthony, thanks for hanging on. How are you?
Oh, good, thanks. How you doing?
Good, sir. What's on your mind?
Well, I suppose it was about 18 months ago I was diagnosed with a torn rotator. Now, so we started out with the ultrasound, then we went to the MRI, and they sent me to a clinic here in Mississauga. And basically, they were supposedly a rehab specialist. And I asked her what we could do, and, within one sentence, she basically came up with absolutely nothing. You have what's called frozen shoulder. She said, because of your age, 95% of the people of your male, whatever, get it. You just have to kind of let it run its course. And the only problem is I'm an aircraft mechanic, and my shoulder, I've got, I'm right-handed, I'm lucky, but I still do have to do
it's necessary.
Yeah, so I mean, assuming it is frozen shoulder, which I'm going to assume that based on what you've said, it's definitely not an easy thing. It doesn't go away quickly, but it's also there's also more than nothing that can be done, I guess is what I'd like to say. You don't have to leave it just up to time. There are some conservative interventions, exercises, and other physical medicine modalities that can be done to help expedite the period of time it takes to get through it. It by no means is a quick fix, right? Like the frozen shoulder is not one of those things that, 2 or 3 treatments and you're brand new. It could take frozen shoulder, the natural history of frozen shoulder, if you do nothing at all, is somewhere between 18 months to 24 months. With intervention, if you can cut that, say, in half or by 2/3, that's a realistic goal. But definitely something can be done. There's more than nothing for sure.
So what are we looking at? Is there physio or?
Yeah. So again, I'm always hesitant to say it depends on your specific case, right? I haven't assessed you specifically, so I'm going to assume what you're saying is frozen shoulder. But if you came to see me,
that's what she told me.
Yeah, no, I understand, but I would do my due diligence as a professional. And once we figure it out, I'm answering the question more, assuming it is frozen shoulder. There are things that can be done. Yes, different interventions, different therapies can help with frozen shoulder for sure.
Okay. Okay, thank you.
Thanks, Anthony. I know your next question was probably how do I do that? Well, here's how you reach out. You go to 1-855-55-Dr. Lou, DRLOU, and info@pinpointhealth.ca. Anthony, put you on the right track. Basically, what is frozen shoulder? What's he speaking of?
Frozen shoulder is, so if we look at the bones in the shoulder, there's a capsule that surrounds them. The medical term is adhesive capsulitis. So when that capsule just completely tightens, we don't understand actually why it happens. It does happen more commonly in the elderly, people who are diabetic, and if there's been previous shoulder injury. But for whatever, in certain instances, that capsule will just tighten up, and what ends up happening is they essentially lose range of motion, so they're unable to move because of how tight it is. And some of the therapeutic intervention is just really on trying to break that up. There's also, in extreme cases, you can do surgery for it where you can release the capsule. So that's why I'm a little confused about someone saying there's nothing that can be done. There's definitely stuff that can be done. Again, it's not simple. It's not one of those things that's, 1 or 2 times and you're brand new. It can take some time, but there's still something that can be done for sure.
We're not sure how old Anthony was, but is this an age-related thing? It doesn't matter.
It can be. It tends to happen more often as people get older, for sure. But I've also seen it in very young people because sometimes it's also follows trauma of some sort. So again, there is stuff that can be done for it. That's the good news for Anthony, and we'll make sure we have someone call him.
All right, where do you want to go? We still got a couple minutes before we break. I know you got lots more to cover.
Yeah, well, so going back to actually Anthony's, the way he started the call, where, again, it was sort of that thing on reliance on ultrasound and, for the shoulder. And that's one of those things, like, if we took 100 people right now and we ultrasound their shoulders, we're going to find levels of anomalies, which mean things that aren't ideal. So we're going to find some tearing and some other stuff. That doesn't necessarily equal what the cause of the pain is. And that's the problem with a lot of this imaging. It's really the job of the radiologist is to comment on everything that they see. It doesn't matter whether they don't know because they haven't done the clinical exam. But most times if you see it, it'll say impression, and it'll often say correlate with a clinical exam. So, when I see tearing on a on an ultrasound or an MRI, the next thing I want to know is their weakness in that muscle. Is it, or does it even function?
Right.
So this is the reliance, again, going back to why it's so very important to have a good clinical exam for these types of problems, and not just the reliance on imaging.
You know, you say that all the time, and people they put so much reliance on imaging. Sometimes they figure, I don't think the physical exam is as important because, you know, they rely on technology and good old fashioned, you know, touching and feeling. I mean, in a physical sense of feeling a problem with someone's knee or shoulder. They don't put much reliance in it anymore. Everybody wants a computerized image, right?
Yeah. And it's not just as simple as just touching. There's a lot of different tests that can shear different structures and check their integrity. And that is really what is more important, is clinically, what is the person presenting like versus what the imaging shows. And you know what? Sometimes the imaging does correlate with the findings.
Sure.
I'm not saying that it doesn't line up, but the statistics on it are about 50-50. So it's a coin toss.
Reaching out, info@pinpointhealth.ca through email. It's a Pinpoint Health Show continues. Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
Back here, a few minutes left to go. Got Debbie on the line now. Hi, Debbie. Good morning.
Hi, good morning.
What's going on?
Well, I've been in physio for about 2 months now. I have a really bad right shoulder. My profession was grooming. I was a dog groomer, and I sold my business. And what I did from June till September last year was insane after the COVID, right? Closing down and opening and keeping up with the backlog. And I came home and slowly my shoulder started to hurt, and I think because I stopped doing all that repetitive motion. And then, so I finally decided to go to physio, and I mean, it was right from my shoulder blade to my top of my arm, down my arm, even in my rib cage down my side, I could feel it. And she's got me doing sleeper stretches, like my arm could only do about 10% mobility. Sleeper stretches, with the forklifts, and using that shockwave machine on me, which felt good. It did feel like it loosened up a lot of the muscles. But I went skiing 2 weeks ago, and then I reached over to get my purse behind my seat, and oh my God, I thought I was going to pass out. The pain was just incredible. And now I'm right back to where I was, and so I have another appointment on Tuesday, and I'm thinking I need an MRI. You know?
And, so, I mean, if you've done something to aggravate it, then it makes sense why you would symptomatically be worse, right? So I don't, even, you might very well, I mean, anytime someone's not getting better, you will need to be reassessed. Again, whether an MRI is of value or not, I think I'd leave that up to whoever the treating professional is. Like, I can't comment on that because I'm not treating your shoulder. But again, to get an MRI is going to probably take you 6 months, right? So if you don't achieve something in that period of time, that's not going to be good in terms of the prognosis. So I think a lot of the times it's about, like, how much therapy have you done prior to this exacerbation with skiing?
I've been going once a week, plus doing all the home exercises. But I've even stopped doing the home exercises right now because I'm too afraid to agitate it, you know?
Yeah, so this sounds like an example of, prior to this exacerbation, were you getting better?
Yeah, I felt better, but still very painful in my, it was getting better, yeah.
Yeah, so then you've done now, so you were getting better, you were on the right track, and you did something to sort of put you backwards a little. You'll just have to sort of deal with that. I'm sure the therapist, whoever you're seeing, will sort of address this. And, you know, this is the big thing about when you have an injury, it's also, you've got to mitigate the things that you do that can exacerbate that injury, because, you know, that can set you right back. But that's what it sounds like happened here.
Yeah, I just wanted to make sure, like, my tendons weren't shredded or something, you know, because, I don't know, it's just certain movements, I just don't have it, you know, like I've been dropping things, and, like, I think I've broken 3 glasses in the last 2 weeks, and, yeah. So.
Yeah, so, you might need a neurological exam, that type of stuff. Again, these are all things that are clinical exams more than they are an MRI, like in terms of assessing for weakness. There's motor testing that can be done clinically to determine whether that's actually the case or not.
Do I go through my physiotherapist, or do I go right to my GP?
Your physio should be well enough equipped. I don't know, right? Like, the reality is it's always difficult. I know a lot of good physios. I know a lot of bad ones. I know a lot of good GPs. I know a lot of bad ones. If you trust the people that you're seeing and they seem like they're knowledgeable, there's no red flags, then I think you're in good hands.
Yeah. Okay. Well, they did offer me a phone shot, so okay. Thank you very much.
No problem.
Thanks, Debbie. Really appreciate your time, and thanks for calling through. And best of luck. You want to reach out to Dr. Lou? You can. It's 1-855-55 Dr. Lou, DRLOU. info@pinpointhealth.ca as well. That is that little phone call right there is kind of what goes on when you're talking to someone generally on the phone for a quick assessment. It's interesting. I could sense a little bit of relief in her voice already, but it's just digging a little deeper, isn't it?
Yeah, it's not a bad thing to just see if someone's on the right track. I don't hear anything there that's super concerning in terms of like red flags on the therapist side. But that is a classic example of what people will often happen with people as they're going through a process of getting better. They feel better, so they try to do some of the things that they would otherwise do, and that can aggravate your symptoms. And if it aggravates your symptoms, you might have aggravated the structure or whatever the pathology is that's going on, and so now that can set you back. That's a big thing. Setbacks are a big thing that we deal with in the treatment world when people don't sort of stick with the game plan. And that, I don't mean that to say that it's her fault. Like, things just happen. It could have been anything, right? But setbacks do happen, and so people have got to consider that, and that's why part of what the therapist or the doctor, whomever it is, should be doing is also educating people on the things they need to be avoiding, right? They've almost got to become almost like a planner for you for the next little bit. And that's what I try to coach patients on, is like, here's your problem. Here's what I'd like you to do. But along with what I'd like you to do, here's what I'd also like you to avoid completely. Or here's what I'd like you to do your best to avoid if possible, or whatever variation of that. But there's some things where I give a hard line and I'm like, don't do that. Right? And I also will tell people, if you're thinking of doing something, run it by me first if you're unsure, right? Like, send me an email, call me, or when you're in to see me, just ask me, hey, I'm planning on doing this. What do you think? And a lot of the times it's not an absolute no, don't do it, but it might be, well, try that, but, try to do this modification, or try to avoid this part of it, or whatever it may be. And that's where there's got to be constant communication between the healthcare professional and the patient as they go through the process of that injury management and pain management program.
Yeah, it's good because they also have to play the mental game and not get down if, they get back up and they fall down again, and you got to pick them up and try something else. I know that's a big part of it as well, is, just keeping them focused at the task at hand. That there probably is a way to get through this thing, but you might have some ups and downs along the way too, right?
Absolutely, and treatment is never linear in terms of getting better. There's some days, I always tell people, like, I can look, at an injury and say, okay, I typically know that this type of injury, like the frozen shoulder is a good example. Like, I know that this might take, 12 months. What we're looking for is that in 12 months, you're better than you are today. But if we look at 3 weeks from now, you might not necessarily feel better than today. There might be ups and downs, and we've got to continually do our job to reassess, to make sure that the diagnosis is still right, and that we're moving on the right path, right? Like, that's the job of the practitioner. But yeah, it's not always a perfectly linear process. It is something that can have its ups and downs, but over a period of time, what you'd like to see is that there's a beneficial change.
You want to reach out now that we are done for this show this week, you can do so really simple. Just make that phone call, talk to Dr. Lou and a member of his team, 1-855-55 Dr. Lou, DRLOU. If you're into podcasts, you can check out the long-form podcast called The Lou Down, wherever you get your favorite ones. There's great stuff on there as well. And email info@pinpointhealth.ca. The clinics are always expanding. They're open. They're serving you. They're helping people. So don't hesitate to contact Dr. Lou and his staff. We'll catch you next time on the Pinpoint Health Show. This is Global News Radio.
The preceding was a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.